My name is Raymond Bucoy. I'm the program chair of the Intra Oral Dental Assistant program of Anderson College of Health, Business, and Technology. I have been an academic for the last 28 years, and I have a formal education background on dentistry, and I'm also a certified dental assistant here in Ontario. The Intra Oral Dental Assistant program in Anderson College has 51 weeks in length. We teach them the theoretical portion, and we also teach them the clinical portion. Right now I'm in the clinic. This is where they go for their clinic practice. In the theoretical portion, we teach them all the basic sciences, how to identify instruments, the functions of the instruments, and then when they come in the clinic, they see the actual instruments, they learn how to pass the instruments, they learn how to mix the materials, and they learn how to help the dentist, because that's what we're training them for. They learn how to take x-rays, which is their cup of tea. We train them very well in radiology. We train them how to mix materials. We train them how to pass instruments. We train them how to take x-rays and record takings, medical dental histories of the patients. They learn quite a lot in the clinic during that time. The fears that they have is usually if they cannot meet their own expectation. They fear they fail the exams, they feel they fail the clinical exams. That's the number one thing that they have in their mind, the fear. Their fear of failing the program. That we always convince them that it will not happen as long as you practice, as long as you study hard. They will make it. We'll help them too. Most of the typical questions, if they're new in the clinic, is the clinical portion hard? Is the theoretical portion a lot of exams? That's the most typical questions. Or, I think the most recent one student asked me, are we going to work on each other's mouth? In the lab, we train them how to get molds of the teeth. We train them how to create molds. We train them how to mix cements. We train them how to make custom trays. We train them how to bleaching trays, mouth guard. In the clinic, we train them how to pass instruments. We train them how to identify instruments. We tell them how to take x-rays, proper x-rays. In Anderson, we're all using real radiation here. So they're really taking extra precautions when it comes to that. That's all part of their training. It's the clinical portion. It's here, if you can see later on, it's here that they enjoy a lot when they're in the clinic. Because this is the time wherein they act as an assistant and the instructor will act as the dentist. So they transfer instruments, they transfer the materials, they prepare the syringe. This is the part where they enjoy a lot. The clinical portion is the one. But they enjoy the theoretical portion, but I think when they come in the clinic, they apply what they learn in the theory portion. Anybody can take the program, especially if you're a high school graduate. Matured students are welcome in the program. We even have international students too. So it's basically, as long as you finish your high school, you're welcome to go to our program. The students can become certified not after graduation, but after they pass the board exam. There's a national board exam that our students are encouraged to write. Once they pass that, then they become certified dental assistants. It helps a lot. It's beneficial for them for position seeking, job seeking especially, and salary rate maybe, compensation rate. It affects a lot if you're certified. In our program, we don't only train them to become a chairside dental assistant, but we also train them how to become a front desk dental assistant. So if they are not busy assisting the dentist, they can actually be on the front desk answering telephones, making appointments. So we train them in different aspects. So they can always work in an ordinary, regular dental offices, but they can also work in hospitals. They can also work in public health. They can also work in being a salesperson, selling dental products, because we train them of different products in dentistry. As a matter of fact, they easily find job. The nice thing with our program is that we have these 100 hours that they have to do before they are considered a graduate. They have to do a practicum of 100 hours. So during this practicum, they develop a rapport with the dentist, with the assistants in the clinic, and the patients. So most of the time, the employer or the dentist will absorb them. They'll hire them right away. So as far as employment is concerned, we have no problem. We have no issue. As a matter of fact, we have dentists calling our campus, asking for dental assistants if there is any available that they can be employed in their offices. Future students, study hard, Enjoy your time being a student. If you fail, stand up, rebalance, and move to the next step. Never give up. Never give up. That's how I did it. I never give up.